Hello and welcome to our today's topic. And today we want to get at this topic about how best we can give the best service to our patients. And in this case, a patient might also be your client. The patient might also be bringing some coins to your pocket. So you want to know how to give the best service, how to give the best attention to their demand or their needs. And in this case, their need is some restructuring of their health. So this is basically a guide to giving your patient the best service. And this is for the medical practitioners, all those who are in the medical field, the nurses, the clinicians, the medical officers, the public health attendants, the human resource records managers, everybody in the medical corridor. So the first one is have the best interest at heart, have the best intentions in your heart, so that as you deal with the patient, the best intention is to offer the quality and the best service so that it might promote health. You want to give a quick recovery, you want to give a quick recuperation, you want to give the best of service so that in the next few days, in the next few minutes, the patient might be off the pain. So you want to give the best. So you have to give the best and have the best intentions at heart, have the best interests at your heart, so that health of your patient is the best and the first interest in your heart. So the next point is that you have to listen more without judgment and offer the best knowledgeable solution and the best practice solution to the patient. Listen to their intention, listen to what they are saying, listen without judgment, do not interrupt. Let them sit across your table and have an eye contact. They can sit on your side. Let them have the best of eye contact so that as they explain and integrate their points to you, you might be noting them, you might be writing, you might be nodding your head, you might be walking through their feelings without judgment, and just make them feel comfortable around you and let them feel comfortable to open up and let them feel comfortable to talk more, to open more, to give their thoughts and to listen to you also, and to listen to what you're saying, to listen to your guidelines. It might be nutritional guidelines, it might be lifestyle changes guidelines, it might be any of the guidelines which will promote their health and lead them to quick recuperation. So you have to listen more and talk less and give the best of the professional advice to your patient, who happens to be also your client. So the other important factor is that you have to always scan your patient's socio-economic background, know where they come from, know where they live, know their locality, and at least establish to know their background and check who they are, because sometimes there are people from low socio-economic status, sometimes there are people who are not even able to afford the consultation fee, sometimes there are people who just even need mercy, there are some people who even need free service, others need just to be talked to, just to be listened to without even asking for anything in return. Sometimes you have to just scan their socioeconomic status, sometimes not whether they will afford the drugs, the expensive drugs you're rating. If you have to use generics, the better. If you have to use the original drugs, original brand name drug, the better. But sometimes if they cannot afford, just work with the generic, because they are just as pure as a brand drugs. So just know your patient, just know where they come from, and sometimes you might write prescriptions which the patient will put in the cupboard and never buy those drugs. So you have not given the best solution if the patient will not buy the drug, if the patient will not be able to afford the service is not helpful. So just check the socioeconomic background, the affordability of the drugs, the availability of the drug, and the accessibility of the service you are proposing or you're offering. So the next point for the medical practitioner is you practice ethics and practice humanity. At least, if you will not practice ethics, at least you need to doing what is not professional to your patient and acting in an unprofessional and uncouth manner. So always practice ethic and treat the patient as your patient, not as your friend, not as your relative. Always practice ethics. Always keep it short to medical conversation. If it's something about your friend or your relative, let it be outside the consultation and the medical situation level. Just let them keep it out. You can talk your friendship matters after you are complete with what is complaining about, what is the health situation, what meant to have the health seeking behavior to come to your facility or your clinic. So always practice ethics. Always practice the common basic ethics. Do not ask for refunds, do not ask for kickbacks, do not ask for monies, do not ask for their phone numbers. You can give them your phone number, but let them not give you their phone number. Let them call you when they are comfortable and let them call you when they can. The second thing is that you have to practice the humanity aspect, have the qualities of the heart and the mind. Just mind that they have humanity part of them. They are humans. There are people who are feeling, there are people who cry, there are people who mourn, there are people who are happy, there are people who can let the tears go. Just have the humanity. Just sometimes practice giving, practice helping, practice making sure that these people go to their homes feeling that the doctor is their friend. Let them not feel that is someone who is a stranger holding a needle and ready to attack their gluteus, but let them know that they have a friend with a medical practitioner. Let them know that you are their friend, and let them know that you are there to offer them the healing path and the healing rain so that they might at least get home healed. Be the helper you are. Yes. So the final thing to the medical practitioners is you practice your career, you practice the best practice to your clients or to your patient. The final thing is confidentiality and making sure that whatever happens in the doctor's room, in the consultation room, does not get out of the office, and let it remain there, because patients need confidentiality and they trust you. That's why they are giving you the information. They trust whatever they are telling you. They trust the person they are telling the information to. So when they come to you, just make sure that you give them the ultimate confidentiality. Let them have the promise that you are the best to keep their secrets. You are the best to keep their health situations and their health conditions at bay in your heart and in your files only, and let it not be the talk of the hospital corridors that this person has this condition or that condition. Make sure that it remains confidential as possible, and sometimes make the patient feel that he is comfortable. Make the patient feel that she is comfortable around you, and if there is a necessity of a chaperone, let the chaperone be around and observe, and let the chaperone also be a person who is acquainted to confidentiality. Just make sure that whatever happens in the doctor's room remains in the consultation room. Whatever happens in the with the health service provider remains with the health service provider. So that's the best guides to health service providers practice and giving the best optimum care to your health-seeking persons you meet and you contact in the hospital corridors. Be the best, and be the best you can never be, to offering the best of service and the best of curative, preventive and management services. Thanks and bye for now.